Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio in Columbia, South Carolina today, joined by Lauren DeMoss, a healthcare lawyer from our Birmingham office with Maynard Nexsen. Lauren, it's great to see you again.
Thanks so much, Heather. Great to see you as well.
And joining us today, we are welcoming Dr. Stephanie Irby Coard, a professor in the Department of Human Development and Family Studies at UNC, which is the University of North Carolina, Greensboro. Dr. Coard has an extensive teaching background and also conducts research examining racial, ethnic, and cultural influences on youth development and family functioning, and the development and implementation of culturally relevant evidence-based practices targeting African American families and communities. Dr. Coard, thank you so much for being here today.
Thank you for inviting me. I'm happy to be here.
We know we're going to talk about mental health and your work in this area, but if you would, start us off by telling us a little bit about yourself and your role at UNCG.
Sure. I am a professor at University of North Carolina, Greensboro. I'm clinically trained psychologist, and I direct the African American Family Strengths and Strategies Lab at UNCG. And in that lab, myself and my students, we look at the psychological implications of race, ethnicity, and culture on development and on family functioning. I'm also focused on developing culturally relevant and evidence-based practices for parents and families. And implementing them in communities and working in community and community collaborative relationships and partnerships. And so that's what I do. Love it, love working with the students, love applied work and taking my research and making it make a difference.
Dr. Coard, let's kind of shift, as Heather implied, to mental health and your work specifically there. You know, mental health is, I would say, has always been a big issue, but it is especially a huge, huge topic right now, and for the youth. So how would you describe the mindset or mental health of the students you're working with right now?
Yeah, currently I'm teaching two large classes of undergraduate students, and I tend to go back and forth between graduate students and undergraduates. Right now I'm teaching large courses of undergraduate students. And, the students are challenged. I mean, you have students where the mindset is one of growth, and they're looking to develop and they're looking to learn and they're actively engaged. But I have to say that many students are really struggling in terms of trying to remain focused and trying to kind of establish their new normal post-pandemic. I think a lot of the students that I've experienced are very much focused on just tell me what I need to do and I'll just do it. Like, just give me the template, give me the rubric. The idea of creating and kind of thinking out the box or sort of giving them a lack of structure is something that I've received a lot of pushback on because they don't seem to have the bandwidth for that. It's just, feeling very overwhelmed and sort of just wanting to know, what do I need to do to get through?
This might sound like an elementary question, but then how does the mindset, if it is our mindset, how does it impact our learning? Greatly, I would assume?
Oh, absolutely. Absolutely. I constantly try to encourage the students, even when they're not doing so well, asking them to continue to stick in there. There's still more points to earn. There's still more grades to get. And really trying to emphasize the fact that they can still move on and grow and develop and still do, improve rather, right? And so, yeah, because if they're feeling self-defeated, if they're feeling like, it's sort of a fixed mindset where I'm not going to do well, so why even try? Then they're not going to do well at all. We know that the degree to which faculty, professors, teachers expect of them then that's something that will then make them move on to achieve that goal, right? I mean, if we don't expect anything, then why should they expect anything, right? So I constantly, and I've had to be more intentional about encouraging them just because I kind of see a deer in the headlights, when I look across the room. Where are you? Okay, it's okay. We'll get through it together. And, I'm here to support.
Dr. Cord, you talked about students being overwhelmed and this kind of deer in the headlights look. And that's, let's be clear, that's not just students. That's probably lots and lots of folks
Yeah.
right now, and especially post-pandemic. And your students are obviously getting your support and encouragement, but thinking kind of bigger picture, what are the kind of mental health resources you're seeing universities, higher education using, and maybe which one of those are most impactful?
Yeah. Well, I think all universities post-pandemic especially have been very intentional about making sure that there are resources on campus and being very intentional about disseminating information about those resources. We even put it in our syllabi in terms of here are the resources, this is the number, this is where you can go. But they're tapped. There's so much need. Students have told me, yeah, I tried to make an appointment, but the wait list is a month long. And so, there's also a need, I think, for us to think about external resources off campus. And as someone who may have some connections and has networks, I think I'm able to provide that, but all faculty and professors and teachers can't do that, right? But let's just say the demand is there, and we don't necessarily have, I think, as much resources as we need on campuses, but we continue to try.
Let's pivot just a bit, and if you would, speak with us about diversity issues in light of both the Harvard and UNC cases, and also, what kind of impact this is having at a student level.
Yeah. Diversity, equity, inclusion is something that is near and dear to my heart. It's something that I feel is important for everyone to embrace in terms of learning not only about ourselves, but about others and about context and about identities. Because context, identities, we all show up with various aspects of ourselves. And it's important to be intact and in tuned with those identities. And it's important to understand how other identities and how others move about this world, right? And so I think that for me, when I teach, I think constantly around diversity, equity, inclusion, because I want my students to be able to see themselves in the material and the content in which I'm teaching. Okay. And so in order to do that, you have to be fluid and you need to be flexible and you need to be able to think about other experiences and other lived experiences, right? I think it is unfortunate that there's some debate as to the importance and relevance of DEI. I think we can all benefit from learning from one another and from learning about our lived experiences and the realities, the good and the bad and the ugly, and whatever, it is what it is, but it's life, it's history, and it's important in terms of how we go forward. And so DEI is something that is very important to me. It's important in terms of doing community engaged work. It's something that I think UNCG has embraced. And I think it's something that we should continue to support and to encourage our students to embrace it and experience.
Yeah, Dr. Cord, I agree completely. And you talked about kind of the lived experiences and, are the different contexts and how they shape everyone's identity. And it makes me think too, kind of how family issues come into play with students, because they're students and they're maybe not necessarily living at home, but there are lots of family dynamics that can come into play that impact someone's, a young person's mental health. Can you talk a little bit about those?
Yeah, absolutely. I teach courses. A lot of the courses that I teach deal with families, deal with family diversity, deal with parent-child interactions and dynamics. And I say in the very beginning of my courses, I'm going to be talking about a lot of different topics. Some of them may hit you a little different than others. My intention is not to trigger, but the reality is that we all have stuff. Okay. We all have lived experiences that are not perfect, and it's okay. So really my intention is kind of to normalize the fact that families go through ups and downs and, various levels of dysfunction. Okay. And it's really about trying to get students to understand that even in thinking about family dysfunction and family difficulties and challenges, that we also need to think about resilience, and we need to think about the strengths within families. Families do what works for them, and it may not resonate with each family, but if that works for them, that works for them. And we all, are, I think, having the same goal. We all sort of want healthy families and relationships, but we get there in different ways, and it looks different for different families. But absolutely, the ways in which these students are interacting and their relationships with their families are absolutely impacting their sense of self and their contributions in terms of their academic endeavors. And oftentimes students will, come and talk to me and say, this topic really kind of touched me, but it kind of made me think a little different about how I was approaching this particular issue. Or I'm glad that I'm not the only one. I thought it was just me dealing with this type of thing. You never know what students are coming with when they come into the classroom. And so I don't take anything for granted. And I just try to make the students feel safe and make them feel that they're in a space where they can, be as transparent as they, choose to be.
Well, it's clear you listen with understanding, which is nice to hear. You mentioned the word resilience in that last answer, and I'd like you to speak a little bit about how important it is in today's environment, and also if you have any thoughts on how one could maybe work to increase their resilience.
Yeah. We have focused so much on risk and vulnerability, and so little, I think, on resilience and strength, because I feel like for me, I feel really strongly that even when there are challenges and there are issues and there is malfunctioning and, all of that, I feel like it's so important for us to look through the weeds in order to kind of find that strength, that sweet spot, right? Because that is what is going to help us to bring about any change. And I have worked with families and with youth who have been viewed as, dysfunctional and, all sorts of, negative portrayals. And what I really get challenged by and I love doing is trying to look through to see what is it that can be shifted. What's that? How can I use my strength-based, my resilient lens to look through all that and find that sweet spot that I can highlight and use as leverage for bringing about change? And I think that that's really important. And I don't think we do much about that. We tend to fund things and focus on things that are about looking at the problem, but not looking at the solution. So for example, there are many folks, many students, I've had them who have overcome so much adversity you would not believe, but we're focused on the adversity. We're not focused on what was it that made you get through it? How did you find the strength? Was it a coach? Was it a professor? Was it a counselor? Was it the lady down the street? Like, what was it that made that difference? And I think that right there is more attractive, more important, more intriguing than focusing on the negative. We all have resilience, and I think we can even find resilience in maladaptive, I would even say inappropriate, maybe unlawful in some cases. It's about trying to look through that to see, is there a way that we can take this behavior and shift it and make it work in a positive direction?
Yeah, and
I
that's
love that you said, sorry, Lauren, I was just thinking you basically said being an overcomer, for lack of a better way to say it. And I love that. We don't focus on that.
Yep.
yeah. Yeah, and shifting that focus to internal, in terms of not the outside circumstances, but what kind of made you resilient.
Exactly.
So
Exactly.
So kind of wrapping up today and thinking about the work you're doing, what are kind of your main goals, what's your main focus in the coming months or years, kind of looking forward?
Sure. Yeah. Well, like I said, I focus on race, ethnicity, culture. I'm interested in all sort of the dynamics going on in society and how that impacts our development, our youth development, our families functioning, our relationships. One of the things that's really a focus of my relationship is helping parents and families to tackle some of the societal ills that we're dealing with today and have been sort of ongoing issues. Issues around racism, around discrimination, around difference, inclusion, belonging, all of those things. I mentioned earlier how we show up with different identities. And the reality is that some of these identities are marginalized and they're not welcomed, and they're not responded to in a positive light. And so one of the things that I like to do is work with families and specifically work with parents on how to have courageous conversations with their youth around some of these things. Talking about race and racism is difficult. But it's a discussion we all need to have, regardless of your skin color, regardless of your identity. We all need to have this discussion because it impacts us all. And we live in a racially conscious society. And so it's really important to be able to talk to children and youth about what that means. It's important for them to know how to live and navigate the terrain of racism. They need to know how to advocate and be allies for others. They need to understand what privileges that we have and what we don't have, and how to use our privileges to help other people. It's about exposure, and it's about, interracial ethnic connectedness. And unless we have these conversations with our youth over time, they're not going to be prepared to live in a racially conscious society. And when there are insults and when there are things that they are confronted with, it will have a negative effect on them because they won't be buffered. They won't be protected with the tools, the repertoire of tools and the skills to navigate and negotiate. And so that's really what I'm doing. I'm doing that with my own work in terms of parenting programs that I'm developing and have developed. I have a parenting program called Black Parenting Strengths and Strategies. I'm also working with two colleagues where we have developed an online program for Latinx, Asian, and African American families on how to have courageous conversations around race and racism with your youth. We also have a version for white families, how to teach your children to be white allies and anti-racist, and to have these discussions so that we can all have better interracial, interethnic communications and connectedness. So it's one talk at a time, and Black Parenting Strengths and Strategies. And so it's something that is near and dear to my heart. I'm continuing to implement in the community. We have recently been funded by the WT Grant Foundation to implement one talk at a time in North Carolina, and we're in the process of doing that now. And the families are being really receptive. It's online. It's something you can do at your own pace. And it gives you sort of a guide, not saying this is the way to do it and this is the only way to do it, but here are some steps to think about. And you think about how these steps relate to you and what feels comfortable for you, but it gives you some guidance, and that's important. And parents need it. They need it.
If someone was interested in finding out more about One Talk at a Time, how would they do that?
They could do that by searching University of North Carolina, Greensboro, one talk at a time. It is housed in the Caminos Lab, CAMINOS, Caminos Lab at UNCG. But if you just search one talk at a time, if you search Black Parenting Strengths and Strategies in UNCG, then it will show up.
Okay, wonderful. Well, Dr. Stephanie Irby Coard, thank you so much for joining us today. You have a plate of big, important topics to tackle, and we love that you love what you do. On behalf of Lauren and our whole crew, we wish you the best.
Thank you so much. I appreciate it. And thank you so much for giving me the place and space to have these discussions. Thank you so much.
Well, we're glad you took the time. And for those of you who joined today, we hope that this sparked your interest in maybe conversations that you need to have or topics that you need to think more about. And for those of us here at Taking the Pulse, we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.